everyone, it's Margaret Manning here. Welcome to 60 and Me. This is the place where women who are aging beautifully come to be inspired. My guest today is Dr. Sarah Brewer. Dr. Sarah trained as a hospital doctor and a GP in Cambridge in the UK. And after working in general practice, she realized that a lot of illnesses are dietary based. And she's very interested in the whole idea of self-help approaches to treatment and nutritional medicine. So we've got lots of questions for her, and I'm very happy to have you here with us, Dr. Sarah.
Hi, pleased to be here.
I'm really happy to have you here. I just didn't mention that you've written 66 books on this topic of, well, not just nutritional medicine, but the whole area of medicine. Perhaps you could even tell us kind of what you've written about. But and then we can talk about a specific topic today that women in our community care about, which is what happens to the eyes as you get a little bit older. But tell us about the books you've written, Sarah. I'd like to know a little more about your wealth of information.
Okay, well, I've written books about just about every subject you think of, from arthritis, blood pressure and diabetes, through to eating well and living longer, which is something I think we all aspire to.
Definitely. Well, we have a lot of women in our community who are so into well-being. They see health and well-being as the number one priority. I mean, even above money, you need good health. And so those are really wonderful. Your latest book sounds great. It's Eat Well and Look Great. Mm-hmm. Which is really what it's all about. And we're happy to have you here with us, honestly. And the topic, as I mentioned, we did a little survey with our community to ask them what things are, most on their minds. And one was the eyes. What happens to your eyes as you get a little older, and what we can do to, protect them, keep them strong. So what goes on with your eyes when you get older?
Okay, well, there's several things that can happen. Now, one of the most common things is they get drier. So you get dry eyes. And sometimes that's because we're doing things like now looking at a screen and forgetting to blink because we're concentrating. Yeah. So obviously blinking more is a very easy way to help solve that. But as we get older, the glands that secrete tears can dry up. You can also have an autoimmune condition in which the antibodies attack those cells, and eyes do become drier. So when you go to see an optician, or an optometrist, I think they're called now, as most people hopefully do regularly, they will test your quantity of tears, and they'll test lots of other things. So that they might flag up the fact that you're producing less tears. And if that's happening, then you can help to oil the eyes from the inside a bit by taking something called sea buckthorn oil. Which is a supplement which is also useful for dryness elsewhere in the body. So intimate dryness, for example, dry eyes, any part of the body where secretions are drying up.
And sea buckthorn is from the ocean, or it sounds like it sounds like it grows like where you live. You live in Guernsey, right, in the UK. It sounds like something that grows on rocks in the middle of the ocean.
It's basically, it comes from an orange berry and its seeds, which tend to grow on coastal regions. It was used by the ancient Greeks it's fed to their horses to give the horses' coats a lovely gleaming gloss. Wow. So I guess it's good for the hair as well, but certainly it's most famous for its ability to ease dry eyes and intimate dryness. So that's one thing to do. Eye drops, obviously, you can get from chemists. You can get sprays that you spray on, and that's quite clever actually, because when you don't putting something in your eye, you water and it's not so useful. But just spraying on closed eyes and then it seeps in naturally, that can be a nice way to do it as well.
Okay, that's a really good idea. It's interesting you mentioned screens, because I agree with you. I was reading somewhere the other day that one of the challenges with screens is that people actually hold their breath. Oh. That when you're doing email, you sometimes hold your breath and you do not blink. It's almost like you become transfixed by the task and you don't breathe or blink your eyes. So it's a conscious, like you say, an exercise to just blink a little more. See if that works.
Yeah. And obviously drinking water as well. I mean, if we're stuck in our offices, we might not be drinking as much as we should. So when you have your 20-minute get up, move around break, which we should all be doing, then perhaps you have a glass of water then as well. Because hydration is important. And if you are dehydrated, then obviously your eyes will feel more dry. So that's another useful tip.
No, water by your desk or is really important. I've actually now gotten into it. In Switzerland, we have all these levels of sparkling. We've got like regular water, and then there's the green and the red and the blue, and they're all like very light sparkle, so I've actually been intrigued by the choices, and it's made me want to drink water more.
Yeah,
Yeah,
absolutely.
it's kind of cool. Okay, so we got the dry eyes. That's a very common thing that can happen. That's an easy one to take
Hmm.
care of. What are some other maybe more well, not serious, but ones that might need some medicine or some help from a doctor?
Okay, well, one of the most common causes of visual loss in later life is something called macular degeneration, and it's age related. So its full name is age related macular degeneration, or AMD.
Yeah.
Now, that very much has a dietary and lifestyle basis. So
Mhm.
if you don't get enough of the yellow, green, orange types of vegetables that
Mhm.
supply something called carotenoids,
Okay.
then you're more prone to this. Now, these carotenoids we can't make in the body, but we get them from leaves and yellow and orange fruit, and they go to the eye and they concentrate in the part called the macula. And the macula is like a yellow spot at the back of your eye where your fine vision occurs. So that's where you look at when you're the part of the eye you use when you're reading, for example,
Uh-huh.
or when you look directly at someone's face and recognize them. Now, if that starts to break down through lack of carotenoids, then the first thing that goes is you can't read as well. You might look at somebody and see a blur. So
Mhm.
the periphery of your vision is fine, but you can't focus centrally. And that's
Wow.
obviously a
Okay.
devastating effect on your quality of life.
So with macular degeneration, is that actually something you can correct with glasses, or is it something that even glasses at some point won't help you?
No, glasses won't help it because it's the part of the back of the eye which is broken down, if you like. So,
Wow.
simple things like eating spinach twice a week will supply you with a good amount of these carotenoids. Kale is another good source.
Mm.
And then things like carrots, and the old adage, eat carrots to help you
Yes.
see the dark.
Yeah.
But in fact, they do contain carotenoids which are helpful
Yes.
for vision and for night vision. Not smoking is another useful
Mm.
tip. When you
Mm.
smoke, that will also affect the
Mhm.
macula. Getting enough exercise, because that increases blood flow to the back of the eye as everywhere else in the body. So
Wow, that's
that's
very
very
interesting.
important as well. But do get your eyes checked regularly every year, because an optometrist will detect these signs of things that they can be treated if caught early. Their progression can be stopped. So there are supplements with names like macular something or other. I won't give you the trade name.
No,
uh,
you'll
you know,
find them.
there are very good quality trials which show that taking these supplements which contain these carotenoids and certain vitamins and minerals really can prevent the progression of AMD. So again, that's a
Wow.
very useful thing to detect.
This is something like that as you get older, you may not want to invest in, like you just go back and have the same prescription over and over.
Mm.
Same with the dentist. You just don't prioritize those things as you get older because, well, I've got this far, and I used to go every year religiously, but now, I don't. You're saying that you really should, that especially with your eyes.
Absolutely, because
Yeah.
once you hit 60, that's when things are, sadly with the
Yeah.
eyes, it can be downhill if you're not careful. And obviously, we all get long-sighted as we get older. That starts around the age of 40, 45. And
Right.
by the age of about 60, you've lost all your ability of the eye lens to focus. So, you do need to look after your eyes.
Wow, that's really great information. So, okay, so macular degeneration.
Mhm.
What about cataracts? That's something that I know I've read about is an issue for a lot of
Yeah.
people.
The cataracts are a cloudiness in what should be a clear lens. And if you think about egg white, when you cook it, it goes cloudy. It's a very
Right.
similar sort of
Okay.
process.
Yeah.
So you're getting this cloudiness, which obviously affects the ability of light to enter the eye and will affect your vision. Things become blurred. You get halo effects around objects. So that, again, can be prevented by dietary means, getting lots of dietary antioxidants, eating lots of fruit and veg. We all know we should be eating at least 5 a day. And it's things like this which are the reason, because you need those antioxidants to protect you, not just your heart, but also your vision. Taking vitamin C supplements was recommended to me when I had laser eye treatment to correct short vision, and the consultant said take vitamin C every day. So I did, and when it helps with healing, it helps with protecting the eye lens. So again, if you do nothing else, a vitamin C supplement can be helpful for the eyes.
It's interesting. When I introduced you at the beginning, I said that you're very interested in the link between dietary habits and good health. And as we've been talking, I've really realized that, you're not just making this up. I mean, this is Mother Nature's way. It contains all the goodness that we need. We just have to pay attention and follow, follow her guidance. But okay, so we've got macular degeneration, we've got dry eye and cataracts. What other types of things happen to your older eyes? Let's see.
Well, there's something called glaucoma, which occurs when pressure inside the eyes build up, and that can occur because you're making too much of the fluid inside the eye, or because the drainage channels have become blocked.
Right.
There's a genetic tendency towards that, so it might be something that runs in your family. And again, that's something you might not realize that you're affected until an optometrist measures the pressure in your eye, and that's done very easily just by getting you to look into a microscope, and then a puff of air is against the eye, and it makes you blink and shock, but it tells the amount of wobble that it creates in the eye, assesses how much pressure is in there. And so again, that's an important test to have done every year, especially if glaucoma runs in your family.
Well, is it like only inherited, or how else do you get it? Is it just one of those beautiful gifts of aging?
Yes. I mean, if the drainage channels become blocked, we don't quite know what causes that, but some people do have a familial tendency towards it.
It just doesn't seem fair, does it? But here's the thing. I mean, the treatments now and the technology and the understanding that you've actually contributed to with all of your books. I mean, just being informed can make the difference between something, taking you over and going past the point of no return to actually doing something about it. Now, sorry, go ahead.
No, sorry.
I was just going to say, the other thing I was thinking about was just vision in general, not just what you talked about, macular degeneration, but just the power of your vision seems to be reduced as you get older. Like people say, oh, well, I have to wear reading glasses now. It's just gotten worse. How does that work, and what can we do?
That's because of something called presbyopia, which is the long-sightedness you get as you get older, and that's related to the inability of the eye lens to change shape. Normally it can flatten out and it can fatten up again, depending on whether you're looking a long way away or close. And that elasticity, if you like, of the lens is lost, and that starts about the age of 45. By the age of 60, you've lost most of it, so then you will need reading glasses to see close up. Your long vision might be perfect. Obviously, if you're not so good either way, then glasses are useful, and that's where you get the bifocals. You get the ones for looking close and the lenses for looking further away.
I can't wear those. Because I actually have got my long vision has gotten better as I've got older. I don't even wear my glasses, partly because I don't drive anymore, which is I think when I mostly needed it. But I've tried the two ones, and I think some people can deal with them perfectly. But I find myself tripping downstairs and looking up and down in the glasses. But it's a great solution if you have to deal with both nearsightedness and farsightedness, or you can wear contact lenses, I guess. Is there any impact to contacts when you're older? Would you?
I used to wear contact lenses. I can't anymore because we talked earlier about dry eyes. Because you're producing less tears, then you can't tolerate contact lenses so well. There are quite a few new ones that have come out in the last couple of years, which are designed for people with drier eyes. It may be that they will suit you, but it's a question of trialing them. You can go along to an optometrist and usually get a 5-day free trial. So if that's what you're interested in, it's worth having a go and seeing. Not everybody can tolerate them, but if you can, that's great.
Well, this has been such a useful conversation. I would advise people to check out Dr. Sarah's website, drsarahbrewer.com, and look at your list of books. I guess they're all on Amazon. Are they actual physical books or mostly ebooks?
A bit of both, actually. I think at least 60 of them are physical books, and probably about 6 are just ebooks.
Okay. Well, this is what we need. Doctors like you who have lived in the real world with real patients, coming out and writing books about what you've learned and empowering people to take care of themselves. It's great. Thanks, Dr. Sarah. I really appreciate your time. Thank you.
Pleasure.
Bye for now. If you enjoyed this video, please subscribe to our 60andMe YouTube channel and also visit our website. We are a strong and dynamic community of women over 60. We're challenging aging stereotypes, and every day we share fascinating stories, interesting questions, and great conversation.